Hi, I'm Dr. Pradeep. I'm a practicing pediatrician from Hyderabad. So most common problems which we see in the establishment of breastfeeding is the one question which the parents ask. That is the mother going to get milk on the first day? That means they feel that in the first day, there is no visible expression of milk. So they feel that baby won't get anything. Then that is the point where they think of formula, they think of starting honey, they think of starting sugar water, etc. So all my life, all the parents, I have been trying to convince them that mother has enough milk, which is enough for the first day needs of the baby. Baby in the first day needs just around 2 to 3 drops of milk. The stomach of the baby is also very small. Even 1 ml, 2 ml of milk will be sufficient in the first day in one feed. So they will be getting enough milk. This is one of the biggest problems I face, that the question directly comes onto my face: is the mother going to get milk? She will not get milk in the first day, so let's start formula. That is one. Second one is when the babies are born healthy, if they are good weight babies, they say that mother won't be able to produce this much amount of milk because the baby is big. So we shall start formula. So weight of the baby is also concern for them. And a good weight baby, they feel that mother won't be able to feed, and that is why they go on to start formula. Cesarean section, mother is very tired. Sometimes it is very painful for the mother to turn around, and that point, due to the pains, sometimes mother will feel discouraged to start feeding. But what we do and what we assure the mother from her point is that once you start breastfeeding, you will be able to produce good hormones which help in retraction of the uterus and reduction of pain, and you'll start feeling healthy faster. So that is what we tell the mother, that initiation of breastfeeding and continuation of breastfeeding in the first day itself leads to better recovery. So this works like magic. Most of the mothers feel because of section they might not be able to feed, but these words work magic. For babies who are born through normal delivery, it's very easy. As soon as the baby is born, if the baby is healthy, we start like early breastfeeding. As soon as the baby is born, within just next 10 minutes, baby will be on the mother's breast. Sometimes we try breast crawl. Some babies achieve breast crawl and they go on to feed. Sometimes babies are asleep, they sleep for some time. We try once or twice and then start them on the breast so that they'll start feeding. So babies born to normal vaginal delivery usually face less problems compared to babies born through section. And other problems is as the days pass on, second day, if the baby is crying badly, the reason for cries are many. Like baby might have a nose block, baby might have a diaper rash, baby might have a wet diaper. Sometimes the temperature of the room might also be different. Sometimes after feeding, initial second day, it might be very rare, but there will be gas in the abdomen. Poor burping might also lead to excessive cry. All excessive cries directly are pointed towards the mother, and the sufficiency of breast milk is questioned by the parents. So we assure them that supply versus demand happens in the first 2 days or 3 days, and mother will be able to completely breastfeed the child. So that is our supply versus demand problem on the second day. There are few problems when it comes to C-section. The mother may not be able to sit and feed the baby, and even though they have foldable beds now, they might feel it very difficult to rise because the abdominal is binded now, and as soon as they rise, they might feel weakness in the abdominal muscles. So we encourage feeding in lie down position also in the first day. Just when the baby is feeding, once we ask her to turn one side and feed, and the next feed we ask her to turn the other side. Initial 2 days is all about the baby learning how to latch onto the mother's breast, and those drops which trickle to the breast, the colostrum reach the mother's breast. It helps the baby satisfy needs, and that is one. So we do not encourage mother to get up, sit and feed. So that problem is gone. The other, I told you, the confidence of the mother after a section. We tell them that the pain will come down faster. So what we teach parents is, as soon as the baby starts feeding, we ask them to feed as long as possible, and once the feed is done, we ask them to burp the baby in upright position. There are many positions you can do. You can do the burping like this. Usually for babies who are doing burping well, we just ask them to pat the back like this, or you can do it on the shoulder. You can do it on the shoulder. You can walk around. You have to pick the baby and walk around. So there are many ways of burping. Burping, we usually tell them till they hear a burp, or you can, if you don't hear a burp also, you try to walk around and do it for around 5 to 10 minutes. Just pat on the back. And then as the baby grows, we continue burping mostly till 4 to 5 months, sometimes 6 months. It is different for each baby burping. But at least 5 to 10 minutes after every birth, it is essential to every feed. It is essential to burp the baby, because when the baby suckles, they tend to gulp of air sometimes, and that air leads to colicky issues, abdominal distension, sometimes a difficulty in digestion. So that is why burping is very important. Indian mentality of a mom is, when she's pregnant, they can give her anything, which is like all exotic foods. All foods are given to the mother so that the baby will grow very well in the womb. And as soon as the baby is born, all parents become enemies of the mother. They don't feed her at all. They say sometimes the stitches get pus. They say sometimes if she eats this, it comes to the breast milk, and then baby will have loose motions. They say baby will get jaundice if you eat this kind of dal or this kind of chicken. So there are many restrictions which come into place when the baby is born. Most common restrictions are, they are not given dal, they are not given egg, they are not given non-veg for few days, and they are given only different very few vegetables, and sometimes they are starved also. They are not given enough food. So what we tell the parents is, general advice is, you have to reach your pre-pregnancy diet plan within 5 to 7 days after the delivery. Once you are at home, you are settled down, you have to take 3 to 4 liters of water per day. You can take small frequent meals around 3 to 4 times per day. It should have a balanced diet. That means it should have all the components like carbs, rice, dal, millets, jowar, milk, egg, non-veg. If the mother is able to digest it well and she doesn't have gas. So once it comes to individualistic approach, if the mother is taking some food and it is clearly pointing towards that the baby is acting differently or behave differently in the last 2 days as soon as the mother took this food, we will try to avoid it and see if it is the reason, or it is basic reason of poor burping or usual gas which comes up at 3 to 4 weeks. So we do not do a blanket ban on any food. We usually tell them, take a balanced diet, reach your pre-pregnancy diet by 5 to 7 days, and also take good amount of water. Frequent means frequent sleep, good sleep, and good amount of water. This is the diet plan which we throw. Moms who are really committed to do continue breastfeeding even if they are working, usually the moms who come to me in our OP are all moms who are doing software jobs, and usually they try to join work anywhere between 6 to 9 months of the baby's age. We teach them how to pump milk while feeding the baby. We teach them how to store breast milk and what temperatures to store. If it is for one day, when to store. Usually, let me tell you this. So, if you are storing the breast milk in open air, Okay, it lasts for around 4 to 8 hours. If you are storing the breast milk at 4 to 6 degrees temperature, it will last for around 24 hours. And when you go below 20 degrees centigrade and put it in a deep freeze, it will last for more than 1 to 3 months. So the collection, we tell about how to maintain hygiene, how to collect breast milk in aseptic fashion, and how to store the breast milk in aseptic fashion. There are breast milk pouches which are available. Sometimes moms prefer storing the breast milk in steel canisters. Sometimes they store in breastfeeding bottles. So usually when they store in breastfeeding bottles, the fat will get absorbed onto the wall, and the other part of the milk stays. So we ask them to shake it well before giving to the baby. And also there is one tip which I want to share. Once you thaw the milk, you should not freeze it again. Once you thaw, I think you should complete the milk in 1 or 2 feeds. So in short, if you are going to work, plan expressing and storing milk at least 3 to 4 weeks before you start going to work, so that you will have a good amount of milk stored, and also you will have a good amount of supply coming out. And usually if the mom is going for 8 hours and coming back between 10 morning, if it's a time gap of 8 to 10 hours, it will be 3 4 feeds. So consider if the child is 6 months, 120 ml into 3 to 4 feeds. So she should be able to express at least half a liter of milk, 600 ml of milk per day. So to maintain that supply chain, she should be able to feed when she comes back, and also able to express while she's feeding from the other breast. So these are the tips to do: early starting of expression, and also having a good diet, and continuing breastfeeding when she's back to the child. Support system starts right away from the birth. We involve pre-pregnancy. There will be a counseling where we involve parents of the mom or the parents of the dad who come to the OP, and we involve mother and father, and we teach them about what happens when the baby is born. What are the positive words which need to be spoken? What are the negative words which need to be avoided during the breastfeeding days in the hospital and also after going home? And how the parent can be involved in breastfeeding. Like we put a video where we gave mother enough space and enough time, and avoided so many visitors into the room, so that mother will be able to peacefully feed the child in the initial days. We have seen that due to number of visitors, the breastfeeding is interrupted, and sometimes mother feel a lot of pain. There will be engorged breast. So these things happen, and we tell the parents that avoid visitors, and try to feed the baby every 2 hours, and also give mother enough space and privacy so that she'll be able to peacefully feed the baby. That is one thing. Second thing is burping part. Usually we see in so many reels that mother will feed the baby and father will burp the baby. I think that is a very positive sign, where we see support system helping the mother to take rest after feeding, and father will be able to burp and play with the child. This helps in giving enough rest to the mother, and so that she'll be able to maintain the supply, breastfeeding supply, and feed the child continuously. When it comes to the parents at home, consider the boy's parents, or mom's parents, or the father's parent. They should be able to provide enough nutrition, and household chores should be taken care of. And if there is an elder child who is at home, there is always a chance that mother will be busy in taking care of the elder child if he's going to school, and sometimes the breastfeeding part of the younger one is disturbed. So we, if there is an elder child, we ask the parents of mother that they should take care of the elder child for some time, so that mother will be able to establish good lactation in the first few months.